Hello, and welcome to another episode of Chats with Chelsea. You are in for a treat. That's right, you heard me correctly. Today we have the one and only Dr. Kendra, MD. You heard me right. Yes, the star of Married to Medicine Los Angeles, that's on Bravo TV. She is an OBGYN, she is an author, as well as she is a wife and mom to heart. So, Dr. Kendra, welcome to Chats with Chelsea.
Chelsea, thank you for having me on. And I just want to let everybody know that what you're doing for women, how you have this nonprofit to help new mothers, to help women in general, and, just chatting with you, I just want to let everybody know, tune in. It's very informative, and I'm ready to get down to business and let's have a chat with Chelsea.
Let's do this.
Let's do it.
So, first off, congratulations to you on your new addition to your family, Baby Heart. Tell us a little bit how it is right now being a new mom yourself.
Whew. Well, Hart is 10 months old, and he is a heaven sent baby because I have fertility issues. I have, a history of fibroids, I have a history of endometriosis. I got married at a later age, so per the book, you know, per medicine, per science, I wasn't a candidate to be a mother. Okay. So, you know, God, he breathed just breath into the womb, and he is the ultimate physician. And so me being as an OBGYN, and I have tons of friends that are OBGYN. So can you imagine me trying to be my own doctor? Well, I know the statistics. And so when I say against all odds, so it's against all odds. And so that's why, the journey to family is different for everyone. I happen to be able to conceive, but, one of my missions is to let women know that the journey to family is different. So it might look like surrogacy for some women. It may look like adoption. It may look like foster to adopt. It may look like insemination or IVF, but God meets us where we are, and I feel very blessed, to be a mother. And then during these times, COVID-19, it's been a whirlwind. Um, so it's kind of interesting. You asked me, how is it going? How has it been? Um, but definitely, it's just been really unique because I think of COVID-19. I've been working more, and of course, the fear and anxiety of bringing home COVID-19. Not only to baby Heart or my husband, but to my grandmother, to my mother. So I have all those same fears like everybody else.
Wow. Well, thank you for continuing to be on the front lines because our health, we have COVID-19 that is before us. Yet there is so much more that is happening in the health of women and the health of African American women. And so I just want to say thank you for continuing to do your work, continuing to educate even more.
Hmm.
And
Hmm.
tell us a little bit about, many moms are hearing that they're either limited to one person or no one in the delivery room. There's different concerns that they're hearing. Tell us what you have been hearing around the delivery room and what's happening there in California.
So right now, with my practice and the same across the nation, it's hard for me to tell my patients these rules, or even some of my friends that are pregnant, like what's going to happen, am I going to deliver alone, or even for prenatal visits, all visits now I just have the patient in the room only. And so because of COVID-19, and because information is changing with that every day, we learn something new, another side effect of the virus. So healthcare is forever changing. But as far as right now, yeah, because we want to protect the healthcare workers, protect other patients, it's only going to be the patient in the room. As far as in the labor and delivery room, If you're COVID negative, okay, meaning no symptoms and there's no suspicion that you have the virus, you're only going to have the partner, that one partner that you want in the room. And unfortunately for the COVID positive mothers, you're just going to be in there with the healthcare providers.
So how do
So
you coach a mom who's COVID positive through that? This is such, well, I can
that's a
only tell
great
you what
question.
I've read or heard, but giving birth is a journey.
You know what? I have a patient. I have many patients. They don't have anybody. So, I want to give a shout out to all the labor and delivery nurses, okay? All the doctors. We've been delivering laboring patients that have nobody. I've done cesarean sections where it's just the mother, just the mother in the operating room and no one else. So, one thing I can say that's so special about my field is that everybody in it, we know it's a scary time, it's a special time, and we become the family. So it's funny now that COVID-19 is up. So what do you do when you have a patient that's by herself? What we've been doing, we become the family, so we are the support. We recognize when a woman is alone. Maybe she doesn't have the support. Maybe her spouse or her partner left. Maybe she's from out of state. No one here. So we become that. And that's what I love about my field, because we know it's a special field and everybody there has a heart for it. So yeah, it's tough, but it's something we all must do. That's why it goes back to what we kind of talked about earlier. you know, everybody's essential. So even as a mom who's pregnant and new mother, and you're scared, but you're doing your part by just having one person in the room with you. If you're COVID negative, that's your part. So that's why I say everyone is essential, whether you're ordered to stay home, or you're working from home, or you're a person that's helping your neighbors who are elderly, or if you are a nurse or a laboratory technicians, whoop whoop, let's not forget about them. you know so everybody is essential, and we're all called to do something. And it may be, I know we get a lot of people about, oh, thank you, you're in the front lines, bravo. But no, but front lines, middle, and the back, we're calling on everybody. The people in the back, we're calling for you too, to follow the rules and to reach out and help people who can't help themselves, per CDC guidelines during this time.
Dr. Kendra, I love I love it's not only a perspective but a truth of there have been moms who have been in these delivery rooms, and so while it may be challenging and not always the most comforting news for an expectant mom, I appreciate you sharing that reality that this isn't something new.
Absolutely. And that's why I really appreciate how you help out new mothers, because if we're blessed to have that village. And you asked me, how has my experience been, being a new mother? And it's funny because I have a perspective of being an OBGYN, and I have to take off that hat, and then now, wow, I'm actually a mother. And I didn't have, I guess I didn't realize or pay attention how it really takes a village to raise a child. So what I'm saying is that through my experience, I've learned that, with heart, like, I'm working more. My husband's also a physician, so he's working longer hours. So I'm really depending on my parents, to kind of take over, the care of my son, how he's doing. I've been kind of missing some things. He grew so tall in the last 2 weeks, but I haven't really had a chance to really take a good look at him. And so I think back to my patients, my teen mothers, single mothers, people with family issues and no support. They're all queens, you know? So, I hope that, instead of people looking at a mother, that single mother, maybe with 4 or 5 kids, instead of giving her an eyebrow raise, no, she needs to be called a queen, because it takes a village. And some of us, we don't have that village. So yeah, so that is what I learned as a new mother, and I have more respect for women in general.
Listen, that was powerful in and of itself. I know that you checked a few thoughts and emotions around this issue. So for the new moms that are out there, because you are a OBGYN, what are your tips to new moms?
Well, let me talk to the new mothers during this COVID-19 because this is a very unique season. And so, I really want to stress to the new mothers, especially when you have an infant. So, if you're a new mom, that means that your child is less than 12 months, right? So, you have an infant. So, it's really important for those mothers to be protective in a sense where they're following the CDC guidelines, really keeping it to just your family. So some of us, we have siblings that don't live with us. Okay, we have cousins that don't live with us. So really buckling down to your immediate family and the immediate village that you have. So if you do have your parents that are helping with your infant, keep it to that and don't extend it if you can, if it's possible, to other family members. Because again, we don't know what everybody else is doing, and we don't want the risk of giving COVID to an infant. So that's what I want to say first. In general, general to new moms, I'm learning every day. And because I can't do it all, I'm learning to say, you know what? As long as we're alive, it's a good day. And I think that a lot of mothers, including myself, we are hard on ourselves because you can't keep the house clean enough. Are you spending enough attention and time to your husband or your partner? Okay. And are you being a good mother? So I've learned now, I start my day with a prayer, and I just say, hey, if everybody's alive at the end of the day, it's a good day. You know, it's a great day. And so just cutting myself, the advice I give to new moms, I'm telling myself too, it's okay not to be perfect in every area all the time at the same time. Because some days you might get, a B minus in the wife area. Some days, you might not, maybe you and the baby didn't have the best day, because you couldn't figure out why the baby was crying. Maybe you're a bad friend because you've been nesting with your child, with your baby, and you just forgot about the world. So kind of giving yourself the break that I can't be all things at once. I can have it all, but just not at the same time, as my father tells me. And so keeping it in perspective. And so that's the biggest advice, for new mothers.
So, this episode is a part of Motherhood in May that I'm doing here on Chats with Chelsi. And so, we've talked about COVID-19, we've talked about new expecting moms. I want to dig a little deeper and ask about what are some of the misconceptions, specifically in the African American community, about trimester four, as some would call it, or things that women, as they are, adjusting to their new baby, that they should know it's okay or this is a concern?
Wow, that's a good question. So, trimester four, okay, the fourth trimester, which now new data shows that it actually lasts a year. And think about it, it takes about 9, 10 months in some cases to create life. And I guess some smart person did a study, and they figured that it doesn't take 6 to 8 weeks for your body or your mind to get back to pre-baby. you know and a lot of women who've already had children, and even myself, just being an OBGYN, I kind of figured that it's not 6 weeks if you had a vaginal delivery or 8 weeks if you had a cesarean. Okay, so but now someone actually are doing studies, and we're actually getting data because we live in an evidence-based society now, right? And we want hardcore numbers, we want facts. So now it's showing that you're postpartum to a year. And just hearing that really made myself, now that I'm a new mom, okay, Heart's 10 months, and it really helps to give me a break, okay? Meaning that It's okay if you feel bluesy, you get a little depressed. Um, it's beyond 6 months. I should be back to normal. No, babe, no. The body, and especially if you're nursing, that's a whole nother component. If you're a lactating mother, okay, your hormones, the way you were, it's not going to be the snap back like we all really want. I mean, Lord knows I want my snap back like yesterday. But it's not going to happen overnight. It's going to take a year for us to get back our bodies, our minds, and some of us really never go back to being the same, meaning that pregnancy brain, that's another thing that I read in the books, but it really, there's no evidence on it. I didn't really know that it really exists. I experienced it. I still have remnants. As slowly as heart is getting older, I'm getting more like myself, but am I at my baseline? No. So just the fact that it's okay, I'm so sorry, it's okay for you to feel weird, a little bit depressed. It's okay to ask for help. And when in doubt, please call an OBGYN. Please make an appointment, because sometimes you just need to go to the doctor and talk about all the body changes that you're going through. So that's my biggest advice. And I want all your viewers to know the postpartum stage lasts for a year. Okay. So let's take a break and let's take it slow and just be easy on ourselves, because society obviously is hard on us. Like I said, it takes 10 minutes to create a baby. And then they told us it's 6 weeks and you're supposed to be like, voila, back at work, everything's okay. No, no. So I think that is the biggest message.
Well, Dr. Kendra, I am so grateful that you carved out some time for us to chat, for you to share this critical information to moms, expecting moms. Please let the viewers know, the Chats with Chelsi community, know how they can follow you in your journey as an OBGYN, as an author, mom, wife, and of course your role there on Bravo TV.
Right. And anybody can find me at Dr. Kendra MD, and that's on all social media handles. And a lot of women, they follow me on IG, Instagram. And if you message me, especially about health issues, I'll take no more than 3 days, maybe now during COVID season, maybe, a week. And I definitely will get back to you. And like I said, I'm for the community. And that's why I decided to live my life out loud on Bravo. Just so people can see themselves in me and to hopefully bring positive change. I'm a work in progress. We all are, but so people can, relate and see that, hey, if I can do it, you can do it too.
Dr. Kendra, thank you so much for joining us here on Chats with Chelsi. Forever grateful for your time.
Thank you for having me.